research is focused on digital mental health interventions, and these interventions have been shown to be effective in treating and preventing a range of common mental disorders, such as depression and anxiety. But challenges remain in terms of how best to design and deliver these interventions in ways that are effective and engaging for consumers.
So my research is aiming to improve understanding of the high levels of stigma faced by people living with BPD. The BPD community faces attitudes that greatly impede their access to care and positive health outcomes, as well as community involvement and access to workplaces.
For my PhD research, I partnered with Medicine Sans Frontières, which is a humanitarian medical organisation. My research consisted of developing and then pilot testing an intervention that was delivered to primary caregivers in settings of humanitarian emergency to help them understand the impact of complex trauma and adversity on children and on child development, and also build some skills in managing the psychological and psychosocial impact of those experiences.
I'm a mental health researcher specialising on Indonesia. I really hope that the work that I do can continue in the footsteps of the great Groom in terms of mental health systems development in Indonesia. So one of the outcomes was a village report. You can see here, Ageing in Rural Indonesia, and we delivered these reports to community leaders in villages, in community healthcare centres, and provided brief trainings about the outcomes of our research and provided baseline data for all the findings that we had.
My research was focused on finding better ways to identify risk factors for suicide and from there building strengths. And so it's specifically focused on the interpersonal context of risk, so things like feeling alone in the world or feeling like a burden and liability on others.
The plan for my project was to develop a randomised control trial to test whether podcasts could be used effectively to try and help support people after separation and actually reduce the risk of suicidal thoughts. So the podcast that I developed with support of the scholarship was a 6-part series developed from the perspective of a clinical psychologist. And essentially I shared tools and strategies and tried to create a supportive community for people who were going through a relationship separation.
I have a strong interest in eating disorders, which are severe mental illnesses, but concerningly help-seeking rates are really low. So for my PhD, I was really interested in understanding what prevents people from reaching out to seek professional help, and I was also working on an online prevention and early intervention program for eating disorders.